Welcome, everyone. We have a very special guest today. We are going to be talking about breast implant illness. What is it? How do you know whether you have it? And we have a very special guest today because it's my wife, Haley Miller. Thank you for joining us today. And what we want to do is kind of give you a platform to tell your story so you can help other women and be knowledge or have a resource or even be aware about breast implant illness. What is it? What's the best way to treat it? How do you know whether you have it? So we're going to use this platform so we can help other women spread awareness about this and be able to help themselves. So let's get started.
Yeah.
Are you ready to make Orlando a healthier place?
I am.
Perfect. Okay, so what is breast implant illness? So let's start off with that because a lot of people don't even know what it is. It's more of a newer diagnosis, a newer concept. But from your experience, from the physicians that you consulted with, what is breast implant illness?
So breast implant illness, or BII, is basically just a name to a group of symptoms as a result of having implants, whether that's saline or silicone. And the symptoms are, far ranging. So it's just when someone has implants, no matter what kind, and they are ill.
Yeah. So you've been very vocal about your diagnoses of having breast implant illness. You've been interviewed by the news station over in Tampa. You've been very vocal about your MS also and helping other women who have this. Now, it's not saying that the breast implants are actually ill. It's saying that certain women may have a negative effect of having breast implants. Okay, and we also see this in orthopedics a lot. We see this with some people who get total hip replacements. You're putting titanium or a foreign object into your body. And there's a subset of patients that have horrible outcomes with a total hip replacement. The majority of people who have a total hip or a total knee end up doing fine. Some do phenomenal. It's helped a lot of people. But what this is there's a subset of patients that react bad to having a foreign object in. There's some specials on Netflix who also highlighted some cases where a patient had a total hip replacement and they had an adverse reaction to cobalt. So they had cobalt toxicity from their total hip, or they just do bad. It's like the body fights the total hip and rejects it, and it's super swollen. It's very hard, and they get bad outcomes. This is another example of this, of putting a foreign object in your body, which would be the breast implant, and that causes an adverse reaction to your body, and then thus these women are getting these symptoms. Now, maybe you would agree with this. Most women probably will be perfectly fine with breast implants, but there's a subset of women that may have this illness or a bad or an adverse reaction to getting breast implants.
Right. So everybody's built a little differently. We have different genes. We have different environmental triggers and exposures. But I would say that some of our immune systems are more sensitive than others. But it's not necessarily that it won't affect somebody, because we all have immune systems. So it's affecting everyone's immune system who has them, but they just might not have as exaggerated of symptoms or as severe of symptoms as others. Some people, they start having symptoms immediately, and other people, it takes time, years, decades. But I'm passionate about spreading awareness so that if you do have implants and you do start having some of these symptoms, that you can look into it more, research it, rather than thinking that they're completely safe and not looking into it at all.
Yeah, because the surgeon who actually did her explants actually does all explants now. He doesn't even do implants anymore. So it is becoming it's becoming more well known about this. So let's go into detail a little bit. So we know a little bit about breast implant illness and what it is. How did you find out that you even had breast implant illness? What led you down the path that led you to realizing, hey, I may be sick because of these. Some of my symptoms are causing this. What led you down that path to find this out?
Sure. So I got them when I was 20 years old. I'm now 33. I would say about around age 21 is when I started having a lot of fatigue. So much so that I went to Mayo Clinic to try to figure out what the heck was going on with me. And they diagnosed me with chronic fatigue syndrome and fibromyalgia. Fast forward to the beginning of last year, I actually lost my eyesight for a period of time. And Ron and I flew to see a neurologist, an MS specialist in Texas. And we were going through my medical history. And he asked me if I had any past surgeries. And I almost didn't even mention the breast implants because, you know, I was told that was cosmetic surgery. I didn't think that it was affecting my health in any way. Plus, I was in a room full of men. So it felt like a little uncomfortable and silly to even mention the breast implants. But I'm so glad that I did because he said, you know, Haley, some women's immune systems really react poorly to these. So you should look into that. And it was like a light bulb moment of, oh my gosh, you know, I want them out immediately. But then I calmed down a little bit, came back to Orlando, met with my functional medicine doctor, brought it up to her, and she said, oh my gosh, Haley, I'm so sorry. I didn't even realize that you had breast implants. And thinking back, I bet I didn't even put it on my forms because, again, I thought it was a cosmetic procedure. I didn't think that it had any effect on my health. And she's like, you absolutely need to get these out. And so that's when I just started digging and found a reputable explant surgeon, because that's another thing that I try to spread to everybody is that you cannot just get them taken out by any plastic surgeon. You must go to somebody who knows what they're doing and does the proper technique so that you don't become contaminated or stay sick, because that unfortunately happens all the time, and that is just is such a sad situation. You want to avoid that.
Yeah, Dr. Darren Akuda really sent that trigger into us, like, wait, that's interesting. He wants us to look into the breast implants about this. I remember him saying something that which triggered the thought of us researching this and looking in more in depth about what is breast implant and how can breast implants cause someone to be sick. So as we started consulting with our functional medicine physician and Dr. Linda Mattili, which I'm going to put the links to everyone below this, as we started to dig deeper, tell them a little bit about the Facebook group, because I think it's very interesting. There's thousands and thousands of women who are complaining of the same symptoms of what you had. And we're going to go into the symptoms later, but they're tracking their own data in this group. They're reporting back outcomes after explant surgery. Tell us a little bit about the Facebook group, and I'll put the Facebook group link below, but there are thousands and thousands of women who are having these same symptoms just like you did. And tell them a little bit about that, because that's how we found Dr. Rankin eventually.
Right, he was on their explant surgeon list of highly recommended doctors, so that's a great resource. So healingbreastimplantillness.com is the main website, and then the associated Facebook group is called Healing Breast Implant Illness by Nicole, I believe. I might be saying it wrong, so we'll definitely have to include the links. But there are thousands and thousands of women, and if you look at the files, there's so many great resources there. Whether you want to look more into the symptoms, or even if you have something that's a little odd, you can post on there and find somebody else who has experienced the same thing as you. Sorry, Tucker wants to say hi. So, but yeah, it's a great resource, both the website and the Facebook group.
Okay, so what was fascinating too was the list of symptoms that you complained about before having implants. Now, you know, if you can, I ask you to bring the list along, because my next question is, you know, what are some common symptoms that you had, and which was fascinating, all these women in this closed Facebook group were complaining of the same stuff. Now, it's not something like you just have back pain, so then you go out and get back pain, okay? These symptoms are like a list of symptoms when things don't line up. when you complain about these systemic whole body symptoms, that standard care sometimes can't solve for you. So I asked you to
Right.
bring your list of symptoms of what you felt before explant, and then to make kind of like note of afterwards, after explant, after your explant, which symptoms were actually removed afterwards. So let's go over what are some of the common symptoms that you experienced during this of having breast implant illness?
Well, before I get into my specific symptoms, I want to say that the two most common symptoms across the board are brain fog and fatigue. And then from there, I've talked to many other women now that have gone through this, and I have similar symptoms with some of them. And I have a good friend of mine who has completely different symptoms than me. Things involving like blood pressure and miscarriage. So not everyone's the same. Again, our immune systems are different. Our genetics are different. We have different genetic mutations. So it can be a little different, but for me, before my surgery, I wrote down a list off the main list of symptoms from the website. And I wrote down a total on August 27th of last year, 29 symptoms that I had from the main list that you can find online at healingbreastimplant.illness.com. My main ones were fatigue, brain fog. Brain fog was getting really, really bad towards the end. Headaches, muscle pain, weakness, hair loss. My hair was like falling out in chunks. And you can attest to that.
I think that was the main thing right after, well, not to go into it, but that was the main symptom that went away right after because you still had MS before and after, and you still had other things going on, but I noticed a significant difference in your hair loss. That was way better after you removed it.
It was falling out in chunks there towards the end, and that was one of the things that I did notice immediately within like 2 days of explanting was my hair stopped falling out so much. Insomnia, inflammation, vision disturbances, thyroid problems. My thyroid antibody level was at 117 right before surgery. So I almost got diagnosed with Graves' disease, a thyroid autoimmune disease. And within 2 weeks of explanting, my thyroid antibody level dropped by half. And then within 3 months, when I repeated blood work again, it was completely normal. So all my doctors were like, oh my gosh, wow, you like narrowly escaped a Graves' disease diagnosis. Thank God. Vertigo, adrenal symptoms, sinus infections, food intolerances, frequent urination, anxiety, depression, feeling like you're dying, leaky gut, fibromyalgia, fungal infections, heart palpitations, sore and aching joints, autoimmune disease diagnosis. Again, everyone's different. So just because you don't have all of my symptoms doesn't mean that you might not be suffering from this. So definitely check out the whole list of symptoms on the website.
Yeah, and I think Linda Mattioli had a checklist of symptoms that you had to check out also. And these are, I'm trying to think it for someone who could be watching this who may think they may or may not have breast implant illness. These are some symptoms where, okay, you may have breast implants and you complain about these, but a lot of standard physicians or functional medicine physicians have not been able to pinpoint what is the root cause of this. I mean, I remember one lady reaching out to you before she had chronic pain, and she had just got her breast implants taken out, and her leg pain was gone. And it was gone, and they didn't even treat the legs, nor they didn't treat the back or the legs or anything. She got her breast implants taken out, and her leg pain was gone. So it's
pretty crazy.
It's a lot of these systemic random symptoms. There's always an answer to why you have symptoms. So there's always a reason of why. I tell patients this all the time. There's always a reason why you're in pain. It's up to the medical field to solve this problem for you. And solving the root cause of why you're having some of these symptoms is huge. Now, there's many diagnoses. MS, there's Lyme disease, breast implant illness that could have been causing some of these. But what we did was we had blood work and testing before and right after. Okay, so out of
Right.
your list of symptoms after you explanted, what were some of the symptoms that you've noticed that you could scratch off your list? For one, from
A
my
lot of
perspective
them.
of things, your hair loss, I would say, was
Yeah.
the thing that I noticed. The brain
Yeah.
fog decreased probably like 50 to 75% easily within weeks after surgery, and your
Right.
hair was not falling out anymore. But what are some others
Right.
that you noticed?
Um, in general, I'm just doing so much better. My brain fog has definitely gotten so much better. Thank goodness. I was feeling so forgetful, and I was feeling like I had like Alzheimer's. And I would say out of my 29 symptoms, I only have like 4 or 5 left. And, you know, I can probably connect those with some other health things that are going on for me
Mm-hmm.
personally. But um, overall, just doing so much better. I'm super grateful for that. I wanted to mention too that, you know, a lot of people have heard that silicone implants can be dangerous potentially, especially if you have a rupture. But the shell of the implant itself, whether it's silicone or saline, is made up of like hundreds of heavy metals. And some people, you know, are more sensitive to those. And also just in general, it burdens your immune system. So it leaves you susceptible to all of these other things. Like your immune system is being suffocated. And so if you, you know, come into contact with mold, which most of our buildings, like something like, you know, 1 in 4 buildings in the US has water damage. So
Mm-hmm.
your body's not going to be able to clear all these things or clear the candida, all these infections and viruses, like because the immune system's suffocated.
Yeah, that is so true, and I think that um, I noticed a significant decrease, not only with your blood work and the changes on that with, for
Mm-hmm.
example, your thyroid levels, but
Yeah.
also some of those symptoms, I believe in a matter of 2 or 3 months, um,
Mm-hmm.
even 2 months, half of those symptoms were gone just from removing your breast implants. And did
Yeah.
they find mold in the breast implants? Because we did get them biopsied.
Yeah. Well, I have the
Or
implants
bacteria.
and there's mold and weird stuff floating around in my implants. And one of them, I had saline implants, and one of them is smaller than the other one. So that makes me
Hmm.
concerned that potentially leaked in me.
Hmm.
Also, I did ask for pathology to be done. So they swabbed my chest during explant, and it came back that I had a bacterial infection on both sides of my chest, which means that I was contaminated during the initial surgery when I was 20 years old when they put them in. And my explant surgeon, Dr. Rankin, said that he sees that in about 30% of cases. So I guess it's quite common to be contaminated. So on top of my body dealing with large foreign objects that have toxic chemicals and by vital organs, I also was fighting a bacterial infection on both sides of my chest due to contamination.
So that's something else that we have to maybe even pester Dr. Rankin to come on, and he can go into more
Yeah.
detail about what he sees
Mm-hmm.
in a lot of these women that could be leading to breast implant illness. So the next question
Right.
is, what was the main factor that decided, okay, it makes sense, I want to get my breast implants out?
Well, definitely the neurologist saying that I need to definitely look into it. And then I had a second conversation with my functional medicine doctor because I was feeling so sick at the time and so weak and in this fog that I said, I don't even know if my body can withstand a surgery at this point. Like, are you sure I should do it now or should I wait? And she said, Haley, 100% you need to do it now. You can't wait any longer. Like, this is imperative that you do this. And she's like, you know, and the saline ones have been known to have mold in them sometimes, which is something I had never heard of before. So I was terrified that I was going to see them. They're going to be filled with disgusting black
Yeah.
mold, which I have seen photos of. Thankfully, mine weren't that bad, but I'm again, I'm just so grateful that I had her encouragement
Hmm.
and her validation that these were really affecting me and I needed to get them out.
Okay. So let's talk about the surgery procedure.
Hmm.
Now, again, this Facebook group of, I think that last time I saw you check, there was like 60,000 women in this group, and it's fascinating. They're gathering data. So they're
Yeah.
tracking who is the best physicians for this. And that's how
Yeah.
we found Dr. Rankin. He's down in Jupiter,
Hmm.
Florida.
Right.
We really got to get him on, and then we'll definitely put the link to the Facebook group. So in case any woman is watching this and they're curious about breast implant illness, that they'll have a link to that group. But we ended up
Yeah.
choosing Dr. Rankin. Um,
I would
what was
highly
your?
recommend him. Yeah, he's
Yeah,
great.
I do too. I thought everything down there was great. Best.
Hmm.
It was excellent service, and I thought the outcome was great, and he was very personal. What was the explant procedure like? What did the process lead to? How was surgery and how was recovery?
It was great. I had a lot of anxiety going into it. Surgery is not fun, and I was concerned about pain. Um, but I knew it's something I had to go through. It actually surprisingly wasn't as painful as I anticipated, actually, at all. I got an extended nerve block in my chest, and that definitely helped with my pain. Um, it was actually just went smoothly. The most annoying thing for me was the drains because I had to leave those in, I think, for like a week. I've heard other women get them out like in a day, but
Yeah,
mine had to stand for a little bit longer. So that was probably like the most annoying part of it. But overall, like real
yeah.
easy.
It was a outpatient procedure. We literally
Yeah.
walked in. You had the procedure done. You had a little bit of recovery, and then we actually were able to go home that day.
Yeah.
And then we had a follow-up visit the next day, correct?
Yeah.
Was it
I
the
also
next
want to
day? Yeah, you had
mention,
to follow up. Yeah, good.
I also wanted to mention that Dr. Rankin offers local anesthesia instead of general. So that's one less thing you have to detox from your body is those gases from the general anesthesia when they put you completely asleep. And that's why he did that, because most of the women who come in, they already have all these other things that they're dealing with health wise and they're needing to detox. So it's one less burden on your body. And it was such an easy recovery. I didn't feel sick at all when I woke up. I woke up immediately. And I was concerned about staying asleep because you don't want to wake up during something like that.
Yeah.
And that didn't happen at all. I was in great hands.
Good. So then after that, you had the drains, and what's the purpose of having the drains?
Just to help with the healing process so that excess fluid doesn't stay in your chest. Um, yeah.
And then, and then we had a follow-up. Was it a week out? You had to follow back up with them, and
The
that's when
next
you
day
got the
and then a
drains
week
removed?
later.
Yeah. So
Hmm.
you had to follow up the next day. They made sure everything's okay, that there's no
Right.
infections, and you're responding good. And we recovered for the
Hmm.
next week. And then you had a follow-up visit the week after, and that's when they took out the drains, and everything was good to go then. Correct?
Yep. Yeah.
And then what are some things that you weren't allowed to do for the next month or something like that? I think it
So
was like, yeah,
I was told that I'm not supposed to lift, I think, more than like 10, 15 pounds for 6 weeks. And honestly, that was one of my concerns being a mom to a 3-year-old daughter who still wanted held a lot. And he actually did show me a way that I could, if I needed to, pick her up so I could do it safely without, ripping anything. So I was grateful that I brought that up to him because he showed me a way to lift her. And then, no weights for I think 6 weeks. I could do quick walking, but no running for 6 weeks.
yeah, okay. So after surgery and after recovery, from your case and your perspective,
Mm-hmm.
how long did it take for you to start feeling changes?
Well, I felt some like immediately, like that same day. It felt like psychological and physical weight had literally been lifted off of me. I could breathe easier. I didn't realize how much weight was just like sitting on my chest. My skin had this glow. It was like the oil came back to my glands, and I remember thinking, wow, I didn't realize how dried out I was. My oil is coming back to my face again. And like we said before, the hair stopped falling out within like 2 days. So those were some of my initial things that I noticed.
Okay, and then let's see. I would say from the spouse's
Mm-hmm.
perspective, the hair loss, the brain fog, and the fatigue were significant differences within the next months. What are some
Right.
other symptoms that you've heard of from other women that they are like, wow, I noticed this within the first month or two? What are some other symptoms that you've heard of from other women that they actually are able to say, wow, I had this and this is gone, this is gone, this is gone?
I have some friends that have zero symptoms now, and they went from a long list to nothing. Um, Everyone's fatigue and brain fog get significantly better. Aches and pains. My one friend, she had, the severe pain in her legs that went away within a week of explanting. Another friend had blood pressure issues. Those are completely resolved. And just everyone overall is just doing so much better. Again, only if you explant properly with a surgeon that knows what they're doing, because they have to do the on-block total capsulectomy technique. And if they don't, then it's just bad news.
Yeah. How can they find out about that technique? And, I know Dr. Rankin does that, but from the
Mm-hmm.
Facebook group, do women report that there's other physicians that know this specific technique also?
Yeah, everyone who's listed on the recommended surgeon list on that
Okay.
website is performs that, because it is absolutely imperative. If any part of so the capsule is what your body puts around the implant itself to protect yourself from the foreign object. And so if any part of that capsule is left inside of you, that's still part of the foreign object. It still has, those chemicals and everything in it. So it's like it's still in you, even though the implants themselves are out. So, and you don't want any scar tissue left. You have to have a surgeon that's trained in these very crucial techniques and microsurgery skills.
Okay. Perfect. And then, are there any other resources that if a woman is watching this and they have breast implants and they think that they have breast implant illness, what are some other resources that we can put in the comments below or even in the description where we could send them to get more information about breast implant illness?
Um, Really just the healingbreastimplantillness.com and the coordinating Facebook group,
Okay.
Healing Breast Implant Illness by Nicole on Facebook.
Yeah.
Those are going to be the main ones. And then, if you go to an integrative physician or a legitimate functional medicine doctor, they can help you help walk through this with you and, you know, validate that these are affecting your immune system. Because a lot of traditional Western doctors aren't going to acknowledge it as being an issue, even though, a lot of us now know that they are not safe.
Yeah. Um, what would you tell someone if a woman is having a lot of these type of symptoms, chronic systemic ones, brain fog, fatigue, muscle ache, stuff like that, and they have breast implant illness? What would you recommend for them to do as their first step?
Well, I would like to say to you, you're not crazy and you're not making it up. And I think getting that validation is so important. And then, checking out those two resources that we've mentioned a few times now. It's really, the Facebook group is especially helpful because you can connect with other women and read other people's stories and post questions, but also in the files themselves is just so many great resources for you to, research this for yourself.
Hmm. Would you recommend Dr. Rankin to others?
Yes, I would. He's awesome and highly skilled, and I'm grateful I used him. He also has a concierge specialist that you can contact almost 24/7, and he can answer any questions you have as well, since, the surgeon, Dr. Rankin himself, has limited time. unless you set up a consult in Jupiter. The other doctor in Florida that I would say does a really great job and is highly skilled is going to be a female surgeon, Dr. Barnett, and she is in Sarasota. I've had a few friends explant with her, and she's also very skilled and knowledgeable about BII.
Very good. Perfect. Well, thank you for going over this stuff, and I think it's going to really spread awareness and help a lot of women who may be struggling with this also. But you're not off yet because we're going to do the Fab Five questions. Are you ready for it?
I am, but can I say one more thing?
Yes, you can.
Okay, so what I was going to say is, oh gosh, now I'm going to forget. Okay, I'll come back to it after your questions.
Yeah, it's okay. Okay, perfect.
Brain
what
fog.
book? Yeah.
My brain fog just flared up.
Yeah, it's that you're nervous from being on a podcast.
Yeah, social anxiety.
What book? Yeah, what book are you reading right now?
I'm actually reading this fun book right here. It's going to be backwards, but it's a book on Lyme disease because I was working with a functional medicine doctor for a while, and I just felt like there was something still going on with me, and I requested to get tested for it and came back positive for Lyme. So I'm researching that now.
Yep, that's our next step. But I highly recommend the book. The book's awesome, and there's a great chapter in there which you showed me, which was MS versus Lyme. So like, no way,
very
is this
interesting.
possible? So we'll keep everyone posted on that.
It's by Dr. Horowitz. Who's, I guess, like the leading Lyme specialist in the country, and it's on Amazon for like $10.
Chronic illness, tick-borne illness, and Lyme disease specialist. So, okay, number 2, what's your favorite restaurant in Orlando?
Okay, so that's hard because, as you know, I love food. I would say my latest new obsession is Me Thai. Off Lee Road. It's a little hole in the wall sort of place. It is so good, and the service is awesome. So I highly recommend it if you like Thai food.
It is really good. Number 3, who is an under-the-radar small business CEO or business owner around Orlando that you love what they're doing, but no one really knows about?
Well, I would say this new shop that opened up in College Park. It's called Good Crowd, and Sarah's the owner. She's amazing. Actually, was just in this morning. If you have anyone you need to buy a gift for, or even if you just want to get yourself something, she has got great taste. You can find something for anyone and everyone at that store. It's adorable. It's at where the Alchemy hair salon used to be. So you got to check that out.
Very nice.
Sure, yeah.
So number 5, what is something new or different that you're doing to keep yourself healthy right now?
I would say my main thing is my diet. That has been a huge thing for me. Looking at food as medicine. And I've noticed, so I'm eating mostly like paleo right now. When I first got diagnosed with all these things, the Wall Protocol book was given to me by Dr. Terry Wall. And it really just changed how I view food, and it helps you understand how to heal yourself on a cellular level. And so I notice when I eat more gluten or dairy that my brain fog and some of my other symptoms definitely flare up. So that's my biggest thing that I try to focus on every day.
Yeah, food is medicine, and that's been a significant change also. All the work from Dr. Linda Mattioli, our functional medicine physician. Online, you can look at Dr. Mark Hyman, Dr. Perlmutter, Dr. Terry Wall. She's publishing research on how she's treating her MS through diet. But diet is so huge in chronic illness, and just eliminating inflammatory foods like dairy and gluten, and doing your blood work and finding out if you're allergic to certain foods and matching your diet that fits your blood work and your chronic disease and symptoms, it's huge. So just by changing diet, I think that's awesome. That's great. And then number 6 is, what is one problem in healthcare that you want to see solved?
It's more of like a mindset, or a cultural thing that I would like to see changed. And that is, if I'd like to see that if someone is having symptoms and they go to a doctor, that just because that doctor isn't able to give it a diagnosis or name or tell you what's causing it, that instead of being told it must be psychological, I roll to that, that they say, oh, let me look more into that, or refer you to someone who might know more, or say, let's explore it. I think that it's a fatal error and a common problem for just because a physician doesn't know about something that they immediately say it doesn't exist or that it must be psychological, must be in your head, which it's sad, but that happens every day. And I can't tell you how many times that's happened to me personally. And I would just say, if you have a doctor like that, find a new doctor, especially one that is more integrative in nature and realizes that everything is connected in our body. Yeah, so that it's more of like a mindset that I would like to see changed.
Yep.
And I just want to empower people, especially women, because throughout history we've been told we must just be crazy. I really want to empower people to be their biggest own health advocate when it comes to these things, that nobody knows your body like you do. And if somebody tells you that you must be wrong, or you must just be depressed, or there's nothing wrong with you, don't let that stop you from getting answers and finding answers. Get a new doctor that is going to believe in you and empower you and help you figure this stuff out.
Perfect. Yeah, I mean, that's huge. Listen to your bodies. There's always a reason of why you're having your symptoms, even if no one can solve it. There's someone out there that's going to be able to help you. So listen to your symptoms, listen to your body. There's always a root cause of why you're experiencing that. And yes, you have to be an advocate for your own healthcare, for your own treatments and stuff like that. Because honestly, if you weren't advocating for yourself, you may have never even found out about the Lyme disease too. So that was kudos to you for pushing and asking questions and leading us down the path of getting a final Lyme disease diagnosis that we're going to keep on treating and seeing and keep on going until we get this end result outcome. So
never give up hope, and sometimes it pays off to be stubborn.
Yep. And then the last bonus question, on a 0 to 10 scale, 10 being really awesome, 0 not, how awesome is your husband?
He's okay.
That was a little bonus question.
Oh my gosh! Of course you
I
had
just
to
shoot
ask
in
me
there,
that.
but it's all good. Don't worry about it. But
no, I'll give you 100 on a scale of 1 to 10.
100, nice. That's awesome. Well, perfect. Well, thank you so much for coming on. The main purpose of this was just to promote awareness about breast implant illness. What is it?
Right.
What are some symptoms of having it? And we're going to put some resources below to be able to guide you and get you some answers that way. It's becoming more and more common. People are having these symptoms, and there is hope. We just have to kind of promote awareness. And I think it's really courageous of you and awesome that you're coming out and helping other women and spreading awareness of this MS and Lyme disease and stuff like that. So we're going to use this platform to be able to help other people and get some answers for them too. So if anyone out there does have breast implants and they're suffering from some of these symptoms, that there is hope and there is a way out, and we got to get some
absolutely.
answers
Never
for you.
give up hope. Never give up hope.
Thank you very much for joining us today, and I will put all the links below, and let us know if you have any questions about breast implant illness. Thank you for joining us.
Of course.